Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Dr. Mohammed Al-Sheef, your host for Elixir of Life, live from Saudi TV Channel 2, kicking off another inspiring and informative episode with our distinguished guest, aiming to explore new frontiers and to keep you updated with the recent information related to health. Our program is very stimulating and filled with many inventive segments. But most importantly, our topic of the week is thyroid disorder. Without further ado, we'll go for a reboot. Welcome back to Elixir of Life. Our next segment will be health myth and fact. We'll talk about raw fruits and vegetables are more nutritious than cooked ones. Please see more details on this report. Stay with us. Don't go away. Hello and welcome back to Elixir of Life. Now we are coming to the most important segment, which is the topic of our week, is thyroid disorder. Thyroid disease is a common problem that can cause symptoms because of either over or under production of thyroid gland hormone. The thyroid gland is an essential organ for producing thyroid hormone, which maintain our body metabolism. The thyroid gland is located in the front of the neck below the Adam's apple. To see more details with our distinguished guest, Dr. AlZahrani, consultant endocrinologist from King Faisal Specialist Hospital and Research Center, and he's also a professor of medicine and endocrinology at Faisal University. Dr. AlZahrani is a highly respected and esteemed international speaker and clinical scientist. He is author of more than 100 publications in peer-reviewed local and international journals and author of chapters in textbooks. Welcome, Dr. AlZahrani.
Thank you very much, Dr. Mohammed, for inviting me. I'm quite pleased to be here tonight.
Actually, it is our honor and a pleasure. You are raising the bar of the program.
Thank you.
Okay, Dr. AlZahrani, we will start by, if you could, shed some light about the anatomy of thyroid gland.
So, Bismillah ar-Rahman ar-Rahim. Thyroid gland, as you know, Dr. Mohammed, is a small organ, actually, located at the bottom of the neck, basically at the root of the neck. In fact, during embryogenesis, during the neonatal life or the fetal life, it forms actually in the tongue root, and then extend downwards to the bottom of the neck. It's butterfly shape, so it has two lobes, right and left, and it has an extension in between called the isthmus. It's a small organ, actually. It's only 20 gram in weight. But this organ is very critical for the function of essentially every cell of the body. So if you have problem with the thyroid, basically the function of the cells of the body and the organs of the body are disturbed significantly, and this can lead to major things like, for example, heart failure or muscle wasting, muscle weakness, and we'll talk about this in more detail.
Sure.
But basically, as I mentioned, it's a butterfly-shaped small organ of 20 gram size located at the bottom of the neck.
Excellent, Dr. Ali. Is it visible in the neck in the normal population, or?
No, actually it's not, because it's too small. As I mentioned, it's a strip of tissue basically at the around the trachea, the airway, and therefore normally we don't see it, we don't feel it. It's only when it enlarges, it becomes visible, especially with swallowing. When somebody swallows, you can see the gland, if it is enlarged, moving, and it becomes also palpable in that situation.
Excellent, Dr. Ali. Now moving to the physiology or the function of the thyroid hormone.
Okay, lovely. So basically the thyroid hormone is secreted from the thyroid gland, and there are two hormones actually. One is called T4 or tetraiodothyronine, and the other one is T3, which is triiodothyronine. Those hormones basically are secreted from the gland, from the thyroid gland, circulate with the blood and goes to different parts of the body and affect the cells of the body. Basically, it's very vital. It's vital hormones for heart muscle, skeletal muscle, the muscles of the body, the brain function. Essentially the gastrointestinal motility, the thinking process, the intellectual functions. So without thyroid hormone, just to give you, to show you the importance of those hormones, if a neonate or a fetus is lacking those hormones, he has a very, very high chance of being mentally retarded in the future. So it's very vital for the development of brain and other organs of the body.
Excellent, Dr. Ali. So this hormone is like elixir of life, because this is our name of the program.
Exactly right. It's the elixir of life. Without them, the function of the body is completely paralyzed. In fact, sometimes I tell patients that these are the fuel of the body. Basically, if you don't have it, you cannot function.
So it should be in fine balance, not over or under production.
Precisely.
So this is leading us to what are the hypothyroidism or underproduction of thyroid hormone symptoms. Okay.
Excellent. So yes, as you said, they're very finely and tunely controlled by an effect of another hormone coming from the pituitary gland, which is another gland in the head. So the pituitary gland secretes a hormone called thyroid stimulating hormone, or for short TSH. And this hormone basically, as the name implies, it stimulates the thyroid cells to secrete the thyroid hormones. And by contrast, if those hormones are high, they actually feed back on the pituitary, telling the pituitary that this is enough and the TSH is shut off. So there is a very nice, what is called negative feedback system, similar to the thermostat in the house for the air conditioning. So if the temperature goes up, it shuts off, and vice versa. Normally in the body, those thyroid hormones are very well regulated at a very precise levels. When they are in excess, then you have a clinical condition called hyperthyroidism. And the hyperthyroidism basically means excess of thyroid hormones. And when you have a lot of thyroid hormone, the functions of the cells are accelerated. And this is not wanted. This is not really what we would like to see. So the effect of excessive thyroid hormone on the body manifests actually by weight loss, increased appetite. So patients, for example, eat a lot, but they lose weight. Increased sweating, and they feel all the time hot. Even in winter, they would like to get more cold weather. Sleep disturbances. They have difficulty in sleeping, or they wake up frequently. They are very easily irritable. They can be anxious for any reason. I mean, they have irritability and anxiety. They, as I mentioned, they lose weight and they lose muscles, so they can have actually muscle wasting and muscle weakness. And in fact, in extreme cases, it can be really paralyzing. We have seen patients on wheelchair because of extreme degree of hyperthyroidism. Other things that the patient may notice is a frequent need to go to the bathroom, diarrhea sometimes. They can have palpitation, that's the heart beating irregularly and very fast. So as the name suggests, this is a hyperactive situation, hyperthyroidism or hyperactive situation. And in extreme cases, we can have what is called thyroid storm, which is actually a very fatal condition if not treated promptly and aggressively. So a thyroid storm is actually the extreme of this. Patients can come with high fever, with mental disturbances, with irregular heartbeat, with heart failure sometimes, and they can easily die. In fact, the mortality of this condition is quite high as 30 to 40%. So this is the spectrum of the disease, between mild degree of hyperthyroidism to extreme degree, what we call thyroid storm. By contrast, the other side, the underactive thyroid, if you don't have enough thyroid hormone, then you could easily understand that or extrapolate from the symptoms of hyperthyroidism to hypothyroidism. Basically, patients will be slow. In extreme cases, they can be even mentally subnormal. They have low attention. They sleep excessively because they have no power. Their attention span is limited. They may have what we call bradycardia, which is a slow heart beat. Their skin becomes coarse and dry. They feel cold all the time, so they tend to cover themselves with a lot of clothes. And they have constipation because their GI motility is disturbed. They're tired all the time. Their hair is coarse and dry and shineless.
And they fall.
So it's, as again from the name, and they can gain weight, although they don't eat much, but they tend to accumulate weight. So all of these symptoms are again underactive. You can think about it. You don't have power. You don't have fuel. Opposite, if you have a lot of power, a lot of fuel, you can actually show hyperthyroidism. So these are the two extremes of the situations.
Excellent. What about the menstrual cycle? Okay, affected in such?
Definitely. So in patients with hyperthyroidism, in young women with hyperthyroidism, they may notice that their period is irregular and of limited amount, and usually 2 days, and then it goes away, and it can come at any time. And it also affects their fertility. For married women, they may not be easily getting pregnant. The same for hypothyroidism. Hypothyroidism is usually associated with irregular period, so it can they may wait for 2-3 months, and then they can have heavy period. Usually they have a lot of bleeding because of hypothyroidism, and again it affects significantly fertility. And more importantly, if they get pregnant, they're hypothyroid, then this can affect the fetus, the newborn. And as I mentioned to you, this is the thyroid hormones are very vital for the development of the brain, and fetuses depend heavily on their mother's thyroid function in the first 12 weeks. So if the mother is hypothyroid, they would not get enough thyroxine or thyroid hormone, and therefore they are very, very likely to be born mentally retarded and with other
very
problems.
important.
Yeah, so you can see this is very critical. In fact, one of the problems we face sometimes is that ladies who are hypothyroid on thyroxine, the replacement, once they know that they are pregnant, They think that this is a drug that it may harm their fetuses, so they stop it. And that's a big mistake. The opposite is true. They need actually to take that hormone. In fact, they need to take extra doses of it.
Mm-hmm. Excellent. Which is more common? Is it hypo or hyperthyroidism?
Actually, hypothyroidism is quite common. Overall, around 5% of the population are hypothyroid at different degrees. So hypothyroidism is quite common, much, much more common than hyperthyroidism. But also hyperthyroidism is common. Interestingly, those diseases are very common in women, much more than men, and especially young women, for the hyperthyroidism. Hypothyroidism actually increases with age. So it is common in young women, but it tends to get even commoner as we age. So it's quite common in the 50s and 60s and 70s.
Excellent, Dr. Ali. Do you have any local data about how common thyroid disorder with underproduction or overproduction in Saudi Arabia?
I must say, unfortunately, we don't. However, we see similar pattern of patients in our country, similar to the West. And the statistics that I've just mentioned are coming from Western countries. So overall, around 5% of the population are hypothyroid. And I believe we have similar prevalence to the Western societies. We have some statistics about thyroid cancer, which we probably will talk about it later on.
Excellent. We are coming to a very important question. What are the causes of hypo or hyperthyroidism?
Very good. Okay. Well, let's start with hypothyroidism, the underactive thyroid. The underactive thyroid, the most common cause is actually immune-mediated disease. What do I mean by that? In our body, the immune system is well regulated to recognize what is called self from non-self. In other words, normally, in a normal person, you would not expect the immune system to attack its own organs and its own cells, because these are self. These are known to the immune system. And the process is very complicated. We don't have time to explain all the details. But for some reason, in certain patients, this self-recognition by the immune system is disturbed. Therefore, some organs of the body are recognized as foreign or non-self or unusual. And one of them is the thyroid. So the most common cause for hypothyroidism is actually a condition called Hashimoto's thyroiditis, which is an autoimmune disease. And autoimmune, as the name implies, auto means self and immunity. So basically the immune system would not recognize your own thyroid as your own and would treat it as a foreign body. And therefore the immune system will attack the thyroid and slowly destruct it, and the cells will be basically consumed by the immune system to a critical degree that the patient will start to have hypothyroidism. So this is Hashimoto's thyroiditis, and the name Hashimoto, this is a Japanese scientist who described it. Interestingly, last year was the 100th anniversary for Hashimoto's thyroiditis description. So Dr. Hashimoto described this condition 100 years ago. He's a Japanese. He described it 100 years ago. And last year, we all, around the world, the endocrinologists, celebrated this recognition of this very common disease, 5% of the population. So this is the autoimmune system. Of course, if the thyroid is taken out surgically, if it is removed surgically, then obviously you will lose the organ that produces thyroid hormones, and therefore you will have hypothyroidism. Radiation, if a patient has, for example, another cancer and he needed radiation to that area, that can destruct the thyroid. There are other rare causes, genetic diseases that interfere with the synthesis of thyroid hormone, enzyme deficiencies, patients who are taking some medication may actually cause hypothyroidism. There are certain medications that we use for different conditions,
like
cancer therapy, for example, sometimes anti-epileptic medication, and those cardiac medication, and like amiodarone, one of the commonly used drugs in cardiology or in heart diseases. So all of these can cause hypothyroidism. But again, the vast majority of patients are having Hashimoto's thyroiditis, the immune-mediated disease. And I think the question that some patients ask, and I wish we have an answer for it, is why the immune system attack the thyroid. The reason for all autoimmune disease, and autoimmune diseases include Hashimoto's thyroiditis, diabetes type 1, vitiligo, rheumatoid arthritis, celiac disease, many diseases. The exact reason for this is not known, but we know the mechanism. We know that the immune system attack those organs, destruct them, result in disease.
Sure. Excellent, Dr. Ali. What about iodine deficiency?
Excellent question. So iodine deficiency used to be the most common cause for hypothyroidism and goiter. Until the last century, in around 1960s, when people recognized the importance of iodine. As you know, iodine is actually the element that is used by the thyroid to synthesize thyroid hormone. So, and the name of, for example, T4 is tetraiodothyronine. So if you listen, if you look at the name, it's actually iodo, means there is iodine. Okay. So iodine or iodine is very essential element for the thyroid, and in the past there was endemic or widespread deficiency of iodine, and this was the main reason for hypothyroidism and enlargement of the thyroid, what we call goiter. But in the 1960s, there was introduction of iodine supplementation. So now if you buy salt from the supermarket, you will find that it's iodized. And we need only a small amount of iodine. We do not need a lot, and therefore this has solved this problem basically. So iodine is no more an issue, except maybe in some countries in Africa or some developed countries in other parts. But for the for the vast majority of countries, iodine deficiency is not anymore an issue.
So it is obsolete disease or vanishing disease?
It is. It has changed the pattern of, again, iodine deficiency was the most common. Now it's essentially unheard of in most countries.
Yeah, because we hear the public misconception that they have hypothyroidism because they are not consuming enough iodine from diet.
Very important point, Dr. Mohammed. Thank you for reminding me. This is one of the misconceptions. So people who have hypothyroidism, they think that by taking extra iodine, for example, from fish, that they will solve the problem. This is not true. You need to take iodine, but it's not going to reverse the hypothyroidism, because the reason is not iodine deficiency. The reason is another issue. So this is one of the misconceptions that I have thyroid disease or hypothyroidism, so should I take an extra amount of iodine? This is not going to solve the problem.
Thank you, Dr. Ali. Now we'll go for a brief report about thyroid disorder. Let's see more details of this report. Please stay with us and go away.
Among all hormonal problems, thyroid diseases are the most common ones. Thyroid diseases can be divided into three major groups. There is an excessive production of the thyroid hormone, which is called hyperthyroidism. There is decreased production of the thyroid hormone, which is called hypothyroidism. Multiple nodules or generalized swelling of the thyroid gland is called a goiter. Hyperthyroidism means that the thyroid gland is producing excessive thyroid hormone. It causes increased metabolism, which consumes a lot of your energy. It is the main reason why people having hyperthyroidism feel tired. Many people with hyperthyroidism are also nervous and stressed, which makes them even more tired. Hyperthyroidism can be treated. Hyperthyroidism has many symptoms because all of the processes in the body work much faster. Common complaints are feeling warm, shortness of breath during exercise, loss of strength, menstrual problems, weight loss, increased heart rate, diarrhea, and psychological complaints like fear and irritability. These symptoms usually do not all occur at the same time. In some cases, the thyroid gland might also be enlarged. The most common cause of hyperthyroidism is Graves' disease. It is an autoimmune disease where your body produces antibodies to stimulate the thyroid gland, which produces excessive thyroid hormone, more than the requirement for normal functioning of the body. Graves' disease may also cause eye problems. Unlike hyperthyroidism, hypothyroidism means that the thyroid gland produces decreased thyroid hormone, which leads to reduced metabolism. Symptoms of hypothyroidism are feeling tired, feeling cold, heart problems, increased in weight, depressed feelings, hair loss, hoarse and deeper voice, and bowel problems. One of the common causes of hypothyroidism is Hashimoto's disease. In Hashimoto's disease, there is an immune response of the body against the thyroid gland, which causes decreased function of the thyroid. Hypothyroidism can result from treatment of hyperactive thyroid. Thyroid disorders can also be caused by changes in the structure or form of the thyroid. In some cases, the thyroid might be enlarged. Goiter is one of the most common thyroid problems. When you have goiter, the thyroid gland gets enlarged and there is visible swelling in the neck. Goiter has several causes, such as infection, iodine deficiency, benign or malignant disease. A malignant disorder is extremely rare. When you have goiter, there can be a problem in swallowing or breathing. Before treating goiter, the underlying cause must be determined. Thyroid problems can be diagnosed with blood test and sometimes using a thyroid scan or a puncture. Other times, thyroid swelling disappears even without treatment. Hypothyroidism can be treated with thyroid hormone pills. Depending on the cause, hyperthyroidism can be treated with medication to reduce the production of thyroid hormone. Another option is treatment with radioactive iodine to stop the function of thyroid cells. Surgery can also treat hyperthyroidism. Goiter can be treated with surgery or with radioactive iodine. Do you have any symptoms which might indicate thyroid problems? Please consult your general practitioner for advice.
Once again, welcome back to Elixir of Life. Dr. Ali AlZahrani, consultant endocrinologist, talking about thyroid disorder. Welcome back, Dr. Ali.
Thank you very much.
We'll go to next question. What are the causes of hyperthyroidism or overproduction of thyroid hormone?
Excellent. So this is another interesting story again. The most common cause for hyperthyroidism is a disease called Graves' disease. Okay, and it has similarity with Hashimoto's story. Graves is actually an Irish endocrinologist who described the condition around last century, around 100 years ago. And what this disease is also similar to Hashimoto's. It's immune mediated. So the immune system actually produces molecules called antibodies, and those antibodies attach to the thyroid cells, stimulate them, and lead to basically overproduction of thyroid hormone. So this is the most common cause. And again, as I mentioned, this was described by a scientist, clinician called Graves, and therefore the disease was named after him. So Graves' disease is the most common cause. But of course there are other causes, including, for example, a condition called thyroiditis, which is actually inflammatory condition, inflammation or activation of the cells of the thyroid gland, basically destruction by immune. Again, this is also immune mediated, but it's a different story than Graves' disease. So this is usually transient condition, sometimes post-viral. In other words, patients will get upper respiratory tract infection, and 2, 3, 4 weeks later, they will start to have symptoms of hyperthyroidism that we mentioned before. And when we investigate their disease, we find that they have actually inflammation of the thyroid gland because of the post-viral effect. So this is one condition. There are situations when you get also thyroiditis due to immune-mediated condition called silent thyroiditis or painless thyroiditis. And sometimes it happens after delivery of women, and they call it postpartum thyroiditis. So these are, of course, if a patient, and we see this sometimes, if a patient is taking thyroid hormone, and this is, by the way, sometimes we see this unfortunate condition. People take thyroid hormone just to lose weight, which is not actually doing anything. It does not cause or help in that aspect, but they take excessive amount of thyroid hormone, and that causes actually hyperthyroidism with all the effects on the body. They can get palpitation, they can get actually irregular heartbeat, they may even die from that. They have all the other manifestations that we mentioned before: irritability, heat intolerance, anxiety, sleeplessness, and so on and so forth. So this is highly not recommended, obviously, approach or practice. These are the common. Of course, there are drugs also that are not thyroid and they can cause it. One of them is amiodarone, again, the drug that is used to control heart rate. Sometimes is associated with some toxic effects on the thyroid and causes hyperthyroidism. These are the common causes. There are conditions that are not Graves' disease. You get nodules in the thyroid, and those nodules become active, a condition we call toxic adenoma or toxic multinodular goiter. These are the common causes. There are rare causes. For example, patients who have pituitary tumor that secretes the thyroid stimulating hormone, or the TSH, can stimulate the thyroid gland to secrete thyroid hormone in excess amount and causes hyperthyroidism.
Excellent, Dr. Ali. You touch upon a very important cause of hyperthyroidism is excessive intake of thyroid hormone. As you mentioned, this is a commonly used in among females. Yes, it's effective method of losing weight, but as you mentioned, the risk is outweighing the
It's
benefit.
not effective methods. In fact, studies have shown clearly that if you're taking thyroid hormone and you're having normal thyroid function, you don't actually lose weight. Okay. It is true that in patients with hypothyroidism, with underactive thyroid, if they take thyroid hormone, it actually helps them lose weight.
Great.
But in a patient or in a person who is otherwise normal, if he takes thyroid hormone, he's not going to lose weight. Even if temporarily he loses 1 kg or 2 kg, he will regain it quickly. So it is certainly not a good practice at all, and strongly recommended against.
Excellent. What are the diagnostic modalities used in thyroid disorders?
Okay, so the basic thing, as we have been speaking, the main thing that happens in the thyroid is either overactivity or underactivity. And that's related to excess amount of thyroid hormone or shortage of thyroid hormone supply. So obviously we need to measure thyroid hormone. So measuring thyroid hormone T3 or T4, and measuring another hormone that is important for regulation of the thyroid function, that the TSH, the thyroid stimulating hormone, are the basic investigation that we do to judge the activity of the thyroid and the thyroid function. So these are essential things. Talking specifically about TSH, it's a very accurate and an easy test to test whether the thyroid is functioning normally or not functioning. So that's one. Then there are additional tests that we do sometimes. For example, I told you that many diseases are caused by the immune system, and therefore we can detect that by measuring antibodies. And there are a number of antibodies that we can measure. There are certain X-rays, types of X-rays that we use to evaluate the thyroid gland itself, like, for example, ultrasound. like the thyroid scan, iodine thyroid scan, or technetium thyroid scan and uptake. And there are additional methods that we use it in a specific situation. But the general investigation that we use is measurement of thyroid hormone and the thyroid stimulating hormone, antibodies, and sometimes ultrasound and thyroid scan and uptake.
So the most commonly used screening method is
the TSH.
TSH.
Is the TSH. So if you have doubt about your thyroid function and you want to do one test, and you don't want to waste a lot of money, and you want to also get very good idea about your thyroid function, TSH, which is widely available in most hospitals and clinics, and also not that expensive, would give you enough information to say, okay, my thyroid is functioning normally, so I don't have to proceed to do any additional testing, or there is something wrong with it, and then I have to seek additional advice and investigations.
Excellent, Dr. Ali. And imaging-wise, the most commonly?
Imaging-wise is ultrasound. But this is another important issue. It is highly important that we don't do ultrasound when we don't need it. This is a wrong practice. And the reason for this is very important to explain why this is not a good practice. Thyroid nodules are very common, as common as 10% of the population, just by palpation. And if you do ultrasound, as common as 30 to 50%. So if you take 100 people from the street and do ultrasound, you are likely to find 30 to 50 of them having thyroid nodules. And most of those high thyroid nodules are not significant. They're not important. They're not cancer. They're benign. The risk of cancer is less than 5%. And by finding a nodule, you're going to subject the patient to further investigation, including taking a sample from that nodule. And then the anxiety that comes with this will be a problem. And then patients have to be back and forth for an issue that may not be important. So screening and doing ultrasound for thyroid is not a good practice at all. It's not indicated except under medical supervision. I mean, if the physician feels that he needs an ultrasound for a reason. But to go to a clinic or a private practice and say, okay, can I get an ultrasound for my thyroid? This is wrong.
Wrong practice.
And if I may just show you how this is not advisable. In Korea, they started a screening program a few years ago, I think in 1999. And what happens? Thyroid cancer increased to 30% because we detect thyroid cancer that is not important. Not every thyroid cancer is important. Small cancer is not important, does not affect life. You don't have to know about it. And that now they canceled that program. They canceled it by government order. So doing ultrasound is not advisable without medical advice or supervision.
Excellent. Now we are coming to, we have mentioned the clinical presentation, signs, symptoms, then we covered the causes and diagnostic method. Now we are going to treatment. How we treat hypothyroidism or underactive thyroid.
Very good. So underactive thyroid or hypothyroidism. Again, treatment depends on what you are missing. And in hypothyroidism, we are missing the thyroid hormones. The thyroid is not able to produce enough hormones, enough thyroid hormones to meet our needs. So the easiest way is basically to replace it. So we give patients thyroxine or thyroid hormone. Thyroxine is available and is cheap, and it is actually a replacement, not a drug. It's actually a replacement for the hormone that we're supposed to have from the thyroid. So patients with underactive thyroid need to take thyroid hormone in doses that are judged and monitored and adjusted by the physician. Doses that are enough to change the patient from active thyroid status, what we call hypothyroidism, to a normal status, or what we call in medical terminology euthyroidism. So we need to bring thyroid hormone to a level that is enough to normalize the function of the thyroid hormones, basically.
Very interesting, Dr. Ali. What's the starting dose? Do we start big dose, or there is gradual intensification of the dose of thyroid hormone?
This is also an important question. So basically, thyroid hormones are present in microgram, small amounts, extremely small amounts. So a normal person would generally need around 1.5 to 1.6 microgram per kilogram. So if we have, for example, a 70 kg man or woman, you would think that around 100 to 125 microgram will be enough for him. And in most cases, this is enough. Of course, we have to verify that it's enough by measuring the thyroid hormones after around a month to 6 weeks. So that's the usual doses. The usual doses ranges between 25 to 200 microgram, depending on the size of the person, the weight, whether he's a male or a female, whether he's young or old. But as I mentioned, as a rough estimation, it's around 1.5 microgram per kilogram. Now, if a patient is healthy, completely healthy, he does not suffer from any cardiac disease or other disease, then you can start that full dose at one time. You don't have to do it gradually. On the other hand, if the patient is having other diseases, what we call sometimes comorbidities, like for example heart disease or neurological disease, or he's quite old and frail, or is having a lot of risk factor for heart disease like diabetes, hypertension, then in this case it would be better to start small dose and then build it up gradually. Because if you put the patient back to euthyroid suddenly, you may accelerate his heart rate, his cellular function, or the cell function, and that may result in trouble. That may result in heart failure or activation of coronary arteries, the myocardial ischemia, the heart attacks, etc.
Excellent, Dr. Ali. The dose is fixed or variable, a condition you change, you increase or decrease?
Okay, so generally every person needs a specific dose. Okay, so let's say Mr. X comes with hypothyroidism, and we start him on a thyroxine, let's say 100 microgram, and then after 6 weeks we measure his thyroid hormone and he's still deficient. We increase it to 125, and he comes back in around 4, 5, 6 weeks. We measure it again and everything is normal. Usually he would need that 125, and we'll continue on it unless something happens in his life. For example, if he's taking additional other medication that may interfere sometimes with absorption, like iron, calcium, some of the drugs that we use for cholesterol treatment. So drugs can interfere with the absorption of the medication. Second thing, also thyroid hormone would be best absorbed on empty stomach.
Empty stomach.
So if a patient he was using thyroid hormone on an empty stomach, and now he starts to take it after meal or with meal or at different times of the day, that can also interfere with the absorption of the thyroxine, and the dose may have to be increased, and we have to advise the patient to go back to his pattern. Women who are taking thyroid hormone and they become pregnant, they may need additional doses of thyroxine during pregnancy, almost always. And very critical, it's very important that the moment they become pregnant, they see a physician, they measure their thyroid hormone, and frequently we advise them actually to increase the dose by around 25 to 30% of the original dose. So if she's taking 100, it would be better once she knows that she is pregnant to move it to 125. So there are situations when the dose changes, but for the most part, if a patient is on a dose, he would need that dose unless something happens in his life. Oral contraceptive pills, the birth control pills, also increase the need for thyroid hormone, and the doses may have to be adjusted. Some other medication, like for example anticonvulsants, anti-epilepsy, drugs that control seizures, also usually accelerate the metabolism of thyroid hormone, and they may need additional doses.
Dr. Ali, can you talk briefly and quickly about treatment of overactive thyroid?
Very good. So overactive thyroid, basically There are 3 ways to treat those conditions, depending on the cause. If it is thyroiditis, we don't usually treat them. It goes away usually, and sometimes we give them a drug to control their heart rate so they don't have a lot of palpitation and anxiety. But for the most common cause, that's Graves' disease or toxic multinodular goiter, we have 3 options. One is using drugs that are called anti-thyroid medications, and there are 2 drugs of this. One is methimazole or carbimazole, and the other one is called PTU or propylthiouracil. So these are drugs, and they have to be used for at least 6 months, frequently for a year or a year and a half. The second way to treat this is radioactive iodine. That's iodine that is having radioactivity. So this radioactivity will go to the thyroid and will decrease the cells of the thyroid. And this is very effective treatment and easy treatment, usually once. And the last, and we don't have to use all of them, and the last option is actually to remove the thyroid surgically, so that's surgery. So again, anti-thyroid medication, or radioactive iodine, or surgery.
Dr. Ali, lastly, what's the take-home message you want to set for our dear viewers?
So basically for thyroid hormones are common, but you don't have to be worried about them that much because for the most part they are very treatable. This is very good aspect of thyroid hormone and easily treatable. For underactive thyroid, it's quite common. If you detect it by screening like TSH or your doctor ordered the test and you turn out to be hypothyroidism, you can have a normal life by just taking a proper amount of replacement, thyroxine. So, and you should be able to live your life normally. This is not a major issue. It's just taking thyroid hormone and you would be completely normal. For hyperactive or hyperthyroidism, the thyroid is functioning excessively, so we have to cool it down, and there are very effective and safe methods, anti-thyroid medication or radioactive iodine, which is probably more effective, or in a rare situation we may need surgery. In fact, surgery is not needed now frequently. And again, you should be able to live normal life once you are treated. So for hyper and hypothyroidism, the treatment is easy. The diseases are common. If you have family history of those diseases, it might be advisable to check them. But in other situations, you don't have to do screening.
Thank you, Dr. Ali. It was extreme honor and pleasure being with us. Dr. AlZahrani, consultant endocrinologist and a professor of medicine, and he's a winner of International Clinician Award by American Association of Clinical Endocrinology. Thank you, Dr. Ali. Okay.
Thank you very much, Dr. Mohammed.
Now we'll go for the last report about health benefit. Please see more details in this report. Once again, welcome back to Elixir of Life. Now we are coming to the end of our program. Before I conclude, I would like to thank our distinguished team headed by our director, Dr. Abdullah Al-Wala'i. I wish you have enjoyed watching our episode and found it useful and motivating. Until next episode, we wish you a pleasant week ahead. Assalamu alaikum wa rahmatullahi wa barakatuh. Goodbye. See you next week.
Made in Saudi Arabia. All the wood manufacturing, which different parts and different shapes in this sector